welcome back. I'm Dr. Noah, your host, and today we're going to talk about a problem, and it's Wednesday, 2013, and the big thing on Google News is about attention deficit hyperactivity disorder. And so it's a disorder that we see, more with boys, and they're fidgeting, and they can't concentrate, and so the whole medical profession has really jumped on this. It's, hey, it's a heyday for drugs. Let's drug up those young boys. And so I know I would have been drugged out of my mind because, I was a kind of smart, but, kind of antsy. I wanted to go out and play. And so if you do that nowadays, they just, once again, drug you up and become a zombie, and that kind of becomes a problem. So in this latest study from January 21st, 2013, Journal of American Medical Association in Pediatrics, they're showing, they're really kind of just either disturbed, or they're just kind of stating that there's been a rapid increase, a 24% increase in terms of this particular type of disorder. And it's even more disturbing for African American kids. It's increased by 70%, and Hispanic it's by 60%. So they're really just kind of, almost going after minorities and really, thinking about doing that. As we'll talk about, the medication, once again, is a very, very dangerous. Once again, studies are once again really poor about long-term kind of consequences. And sure, drug up anybody. Give the kids a bottle of whiskey every day, and they'll just be in a stupor all the time. And sure, that will control them, make them sit in their seat, but doesn't allow them to be able to kind of do too much. And then this study just showed that it's about 300% more likely to be in boys versus girls. So some people think there's a gender type of bias going on like that. And which was more interesting, the more income a family has, it seems more likely. And so that could be all different kinds of things. They have more money, they have better type of insurance, and that's the whole move now, is to try to insure everybody. So everybody has to have so-called sick care. So the drug companies then have a full scope of over-drugging their patients. So yeah, just showed it here that household incomes of more than $30,000 a year were 20% more likely to be diagnosed than people that had less money. So that was kind of interesting. And in the same day, showing that in another study from Harvard Medical School, is what causes this. And so there's different factors, and of course they always want to put the genetic factor. And as we'll talk about epigenetics in a moment here, is that's the big victim type of thing. You have poor genes, it's because your father or whatever like this. I've heard almost on a daily basis, yeah, your mother had heart or breast cancer, your grandmother had breast cancer, you're going to have breast cancer. Well, that's not really true because, genes don't, basically move that fast, but let's not get into details. Your drug doctor would probably fail from his or her genetic class. The other issue is that we know what's the 21st century is epigenetics. It's the environment that regulates the genes. So even if you do have, and there are what are called oncogenes, cancer genes, it's the environment that controls that. And there was that landmark study from the most prestigious medical journal in the world, New England Journal of Medicine, in 2000, was what once again finally put to rest, is it nature versus nurture? Is it the environment, the epigenetics, or is it the genes? And they showed conclusively, using identical twins, 90,000 from Sweden, it's the environments. 90 to 95% of what you are, either healthy or unhealthy, is due to the environment. So that was great news. If it was the other way around, I wouldn't even be doing these spots, because when you were conceived, your genes would have predestined you to either have cancer or heart attacks or whatever like that. There would be nothing like intervention. Now, of course, the drug industry is trying to do genetic engineering. Ha ha ha. We already have things that do that from natural things, and we'll be talking about a nerve 2 activation compound called protandem in a moment here with canines or dogs. That actually is kind of exciting. So that's the kind of the issue here, is that people are, drug companies, and particularly your drug doctors, trying to find type of excuses. Poor you've had bad genes, and so that's going to. Whereas I tell my patients, hey, great news, you take, I'm going to treat you like an adult, take responsibility, empower yourself, and we can undo all these type of bad things. So in this study here, showing that, sure enough, when the woman is pregnant with the child, if they have increased mercury, hey, guess what? They're more likely to have an attention deficit type of problem. So there's an environmental factor. And what do? Make choices with your food. You do different detoxification using natural type of chelators that take those compounds out of your system and the baby like that, which are totally safe. And the other study showed that using, which we'll talk about in a moment with this new protandem for dogs, is Essential fatty acids are very, very powerful. And sure enough, another study showed that people who take EPA, DHA, and give it to their kids, that helps control attention deficit problems like that. So on Dr. U, we've written a book on attention deficit, so we got some suggestions there. But I just want to kind of review some of the different type of problems there. So the symptoms are fidgeting, difficulty remaining in the seat. Yeah, what little boy doesn't do that? Even little girls. I have 2 daughters, and they were just active type of individuals. Difficulty waiting his turn in games, often blurts out answers. I do that still to this day. People aren't fast enough. Hey, get to the answer here. Have difficulty sustaining attention, often shifts from one uncomplicated task to another. I do that all the time. I'm jumping all over the place, and people kind of keep me in like that. Often talks excessively. That's one. Interrupts and intrudes other people. So that's the diagnosis, and that's how they diagnose this thing. If you have 8 of 14, you have ADHD. I mean, this is just so arbitrary. There's no blood tests, any genetic testing. It's just kind of crazy. So they can make up whatever they want. Yeah, Johnny or Mary did this. You got 8 of 14. Boom, you got this, and then they put you on drugs. The classical ones are different type of stimulants, and Ritalin is probably the most famous one. Oh, well, here's a little study here that shows that Ritalin is more potent than cocaine. That's right. In other countries around the world, they know that Ritalin is more addictive than cocaine. And so that's the kind of greater problem. What does this do to the poor child? Sure, it once again turns him into a zombie. And maybe that's good for you because you don't have to deal with this versus exercise and changing their diet and other type of techniques that I use in my practice with great success for attention deficit hyperactivity. But let's just drug them up. It's like I said, all you're doing instead of taking a little pill like with Ritalin is like giving them some a fifth of Jack Daniels and they drink up and then he's in a stupor. Well, that's what happens to these kids is that now their creativeness has all been decreased. The American Academy of Pediatrics ignores the evidence that cancer risk. That's kind of an interesting thing. So as we talked about before, it's not because your mother and father had cancer. Maybe it's the drugs and the environment that once again you were exposed to as you're coming along like that. So that was kind of interesting that this study showed that. Ritalin and cocaine properly use may lead to later drug abuse. Gosh. Well, that's right. More people are addicted to prescription drugs when you go to your drug pusher with a white coat, his or her coat, than people with all the illegal drugs combined. So you see that all the time from celebrities and sports people and politicians. Yeah, they're on rehab because they overdid it with their medication. Nice. Ritalin changes the brain long term. Society of Neuroscience. Once again, science shows is that when you take these drugs, they're very powerful. Just like drinking a lot. So once again, we know that alcohol fetal syndrome causes great consequences to the baby and otherwise. I mean, this is just kind of crazy. But, you go to your pediatrician, you go to your internist, and they give Johnny and Mary these drugs like that. I mean, once again, if you went down to the bar and started giving your kids some drink, they'd arrest you, the bartender, and everybody there. But when you go see your drug pusher, it's okay. Because that's what, make lots of money. ADHD ups risk of adult problems. Once again, antisocial personality. That's kind of interesting. Oh, where was that? Was that from once again, Enquirer? Was that from your newspaper? American Journal of Psychiatry. That's right. See, and that's what's so strange. Your drug doctor, your drug pusher reads these things and says, this causes cancer, makes them become an addict, antisocial. Sure, Johnny, here's your prescription, because I make some money off of it. Pretty sad, pretty sad. And to be fair, there is a split, the schism, schizophrenia, interesting, in the psychiatry field, is the old traditional people where they use talk and other cognitive behavior, which I'm definitely supportive of, but now they've moved into pushing drugs because, one, they make more money, they don't have to spend an hour there, they can just, once again, roll them in, go, okay, Johnny, here, Mary, take this drug, and everything's kind of good. Here's from the American Journal of Public Health. Children over-medicated for ADHD? Oh my goodness. So there is discussion out there, but unfortunately, most of the doctors out there just look the other way. Okay, give me some money. Remember, the drug companies give them over $20,000 a year promoting or bribing, I'm from New Jersey, it's bribing them to once again use this crap that doesn't have any type of insurance, any type of factors like that. So in the physician's desk reference, which is the Bible of drugs, I mean, it's literally, and I'll have to bring one in, it's that thick. It's all about side effects. Yeah, so these things are so safe, but gee, you know, Mary, don't take any type of herbs or vitamins when you're pregnant, but it's okay to take these drugs with side effects that big, with big black boxes, and Ritalin has the big black box, which means it's a big warning there. Here's what the physician's desk for Ritalin. Nervousness and insomnia. Hold it. I thought Johnny was already nervous and it's causing nervousness. Nice. Can't sleep, but that's okay. We'll give Johnny some sleeping pills. Good deal. Anorexia and nausea, so we got digestive problems, but that's okay. There's more drugs to put on that. Give, you know, Johnny some Ritalin. Now he's more nervous. Now we got to give him a sedative. His tummy hurts. Let's give him another drug. Now we're up to about 4 drugs. Hey, we're really doing real well here. Dizziness, headaches, drowsiness, abdominal pain, dermatitis, and skin rashes. So once again, everybody laughs to the bank except for poor Johnny and maybe Mary because of all the side effects. So natural approaches. Now we already talked about the recent study that showing essential fatty acids, EPA, DHA, very effective in terms of not only helping that, but it helps with other conditions. That's the beauty of natural things. Not only does this help kind of, you know, modulate or balance, you know, Johnny or Mary's type of behavior here, but, you know, essential fatty acids have been shown to what? Decrease cancer. Ooh, we can't have that. That's $1 trillion industry. Or how about, once again, decrease heart attacks and strokes? There's a landmark study, we've talked about it. People who took essential fatty acids and people who took statin. And guess which ones were almost 200% more effective in terms of reducing mortality or death rate? That's right, fish oil. But boy, your drug doctor's not going to pass that. They're trying to push that $300 a month statin drugs, which was totally worthless. But that's how it kind of goes in the big city, like that. DMAE, another type of natural substance that comes in different types of seafood. American Journal of Psychiatry showed that the natural substance was very beneficial in terms of helping regulate the brain like that. We have neurofeedback, special type of techniques of using different type of machines and apparatuses in my office and other people to help actually turn on and turn off your brain like that. Let's see here. This is even more scary for drug doctors. Okay, I could sort of understand, you know, a drug, the biochemistry, and certain nutrients and herbs, but don't go into electrical medicine. I mean, that's just way too far out there. So like little places like University of California, San Francisco, well, that's a medical establishment. They use what's called repetitive transcranial magnetic therapy, where they actually put little magnets on your head. Yeah, real science. Other techniques called cerebral electrical stimulation, real science, where we actually work with, you know, working with the brain in terms of, once again, just trying to overpower it with drugs like that. So check out our ebook on that, on attention deficit, and I'm sure that would be very helpful. And I'll talk to you soon. Thanks.